So what is almost coming a weekly chat now with David Ashford for Health and Social Care. It's a Tuesday, you're in the middle of House of Keys sitting. The big news this morning with those emergency questions is that you've got something in place, at least short term, for the Liverpool transfers.
We have indeed. Loganair will be taking over the service, and I'd like to thank all of the patient transfer staff who've worked exceptionally hard over the last few working days to try and make sure that patients could still get away to their appointments. They've been working extra hours and super hard to make sure that that could still happen, and also thanks to DOI who have worked with us on this alternative route.
What's the mechanics behind this? I mean, is it like for like the size of aircraft, the amount of seats you're going to have on board, the guarantee that your people go first, or what?
So Loganair has a certain amount of seats that will be booked for patient transfer. They'll be reserved for patient transfer, but they will also be taking the general public as well.
And when's this starting?
So I believe the Minister for Infrastructure said Thursday would be when it would commence.
Now, behind the scenes, there's some sweetness going on. You have to pay anyway. You had to pay for the FlyBe operation, or at least do a guarantee thing. What is there, and what can you talk about?
Well, there was a contract in place with FlyBe. Obviously, we will now need to sort out a new contract to put in place. But equally, that contract did not prevent us from using alternative routes anyway. Even when we had the contract with FlyBe, we still sent people via the steam packet because there's some people with medical conditions who can't fly anyway.
Are you happy with this? And is it a long-term solution or just fixing things for now?
I believe it is the start of a long-term solution. In relation to patient transfer, though, one of the very interesting things is I've been contacted by several patients who've travelled via the steam packet over the last couple of days who've actually said they prefer that as an option, that they've actually found that to be a much better way of travelling, and these are people who've got conditions that mean long-term travel. And
you put in place that they could have £50 a night and that sort of thing. Is that going to continue then, if that's the case, or does that all end when you have to put them on the plane?
Well, the £50 accommodation allowance is there in statute. That wasn't created simply for this emergency. What we said was that people would be able to book their own accommodation if they so wished, or patient transfer would do it for them. Some people took up the option to do their own and then reclaim the cost back.
Right, let's talk about the numbers. I mean, and the jungle drums keep beating. You're very good, I have to say. A few times I've actually got onto you because what is going on? Everyone's saying there's a case now at Nobles, but they're hushing it up and all this conspiracy theory things. But we're still at zero here, right? But you're doing tests.
Yes.
Constantly doing tests?
Yeah, there's 19 tests that are back to date.
That seems quite a low number, is it? Or is that people just going with sniffles?
No, it's people who meet the criteria for testing. So people who meet the criteria to testing are people who've travelled through one of the jurisdictions who have the developed symptoms.
What is the turnaround on that test again, remind me?
So the test was initially 48 hours. It's now stretched out to 72 hours because obviously we have to send the test away to be looked at correctly in a laboratory in England.
They're under pressure.
And obviously there's more tests coming in from both there and the other Crown dependencies.
So
this is stretching the test time out.
Between having the test then and getting the results, are those people with you in Nobles, are they at home self-isolating themselves?
It's exactly the same as if people actually had the condition. It would depend upon their condition. So if they required medical attention, they would be isolated at Nobles. If they don't, then they self-isolate at home.
Okay. There's a budget happening in the UK, and they've made already allowances about signing on now on the first day instead of the fourth day and that sort of thing. Are you just going to mirror all that legislation in the UK? I mean, like banning big events if they ban them. I think we've asked this before, but
Well, one of the things that we just wanted to quote about events is there's a very interesting piece from the Deputy Chief Medical Officer in England that has actually stated that banning of events at the moment, the advice is it will have no effect. That if they're outside events, then basically the virus can't survive that long in an outside environment. So it's only the internal inside events at the moment that they have advice that need to be reconsidered.
But they are going to have the legislation, well, they have got legislation in place, and you've got legislation.
Yes.
And it mirrors the UK. I mean, basically, when they go with the next level up, we move to the same level?
Well, no, we do it in what's right for the Isle of Man. You've got to remember the UK is further ahead on the curve than us. They have identified cases. They have growing number of cases, but even so, again, it's important to stress the number of cases currently in the UK is still relatively low. It was 321 as of this morning, which, to put it into context, is 4.7 cases for every million people.
And more people got flu and all that. And that sort of thing.
So it's very important again that we actually actually get some facts around the numbers, because one of the disappointing things, the local media, such as yourself, Paul, I've got to say, have been very responsible about this, but some of the scare stories that have been going out in the international media have not helped matters. People are rightly concerned, but it is important that facts are put around this.
But your head of health has said, and I think it was quoted saying it will arrive here, like we all know that. In Guernsey it arrived, someone came through Italy, didn't they?
On the very law of averages, with the spread of this, exactly the same as you see with winter influenza, there is going to be a case on the Isle of Man. It is a matter of when, not if, I would say. But again, it is important that we do things in a measured manner.
But we had panic buying. I mean, I was watching in Marks the other day, they were loading up the old loo roll and it was going off the shelves pretty well as quick as it was being put on, because people see that sort of empty shelf syndrome and they react. I think it's almost, overtakes anyone's thing that they have to have some loo rolls suddenly, they don't need any. Your thoughts on that?
There is absolutely no need for panic buying.
Supply chains are good?
Any supply chains good, supply chains into
the UK. Sanitizer, can you?
Well, we've mentioned this about hand sanitizer.
You're not a keen fan of it.
Hand sanitizer is only effective if the alcohol content in it is 60 to 65%
and some
plus. And some are, but a lot of people will be buying products that are not effective.
You're not a fan of the masks?
In terms of masks, there is absolutely no health benefit being shown anywhere, including the World Health Organization advice is that the only people who should wear masks are people who are actually caring for people with the disease. In fact, this virus, the actual aerosol particles can actually travel through masks. So it's absolutely ineffectual.
So if, but more likely when, the first case is confirmed here, does that immediately change things for you? Like what goes on here and how we react to moving around?
It would change it in the fact that obviously the way we would have to deal with things, because we would then have to trace anyone who's had contact out with that person, put them potentially into self-isolation to see if they develop symptoms. So there's the trace back. But again, I've got to emphasise it's important we do things in a logical, joined up manner, and we don't just overreact with a package of measures that aren't required at this time. And
people should self-isolate themselves if they've been in any contact in those danger areas. I'm talking about Italy and that sort of thing. And in stage 2, the UK is saying if you've got the sniffles or anything, you should go and self-isolate for 14 days. Again, would you follow that?
Well, again, we're not at that stage yet. But the UK advice is actually ahead in the sense that they have actually had confirmed cases. That is not the advice that Public Health England has actually come out with at the moment, that if someone gets the sniffles, they should self-isolate. What Public Health England is saying is if you've had contact with anyone who has developed COVID-19, then you should self-isolate. And equally, if you're coming, as you said, from one of the affected regions.
So this time next week, so I think we should make it a weekly chat if we can. You positive? I'm not positive. I mean, how are you feeling about things at the minute? Let's try that one.
Well, like I say, we've got plans in place across government. All of the departments of government have been working together on how we mitigate any impact. As the Director of Public Health has said, the likelihood is that we will have at least one, if not more, cases on Ireland, just from the fact that this is spread around the world. But like I say, it is important that we focus on the actual facts around this, and there's been so many myths out there and online. So for instance, one of the big myths is the constant increase in number of cases worldwide. For instance, at the moment, the thing the international media seems to focus on is the total number of cases. So they're quoting 114,000, but that's since the outbreak began. The actual number of active cases has come down over the last 2 weeks, where there was 58,000 active cases around the world 2 weeks ago, and there's now 46,000 as of today. But those figures don't seem to get quoted.
No. And also, when people have had it, and I know it can be up to 5 weeks before they're feeling totally 100%, they're the people who will be back to work while the next lot maybe have to go off, right? I mean,
and that's one of the other things. It's when people read articles around about government surge planning and so on, you've got to remember that is planned across the whole of an outbreak. It's not having that proportion of people potentially off all in one go. But it is important that we don't underreact to this. And that is why we are taking planning in place, same as with the UK. We are planning around various industries how government will continue to operate if a substantial amount of people were self-isolating. But it is also important that we don't overreact and start taking measures just for the sake of being seen to take measures. And one of those is one we've already spoken about, which is port checking. where we will be doing something to be seen to be doing it, which has absolutely no show and impact worldwide.
Finally, Chris Robert Shaw was saying how it's impacting on some of his people in Douglas East, the hoteliers. I mean, people are obviously a jittery. I mean, TT keeps coming up, of course, as a thing. I mean, I know it's going to be on like when Wimbledon's on, so is that the sort of test? If Wimbledon got cancelled, then you might have to look at cancelling TT.
TT is a very different event to Wimbledon. I mentioned there earlier the actual comments from the Deputy Chief Medical Officer in England about outside events and the fact that outside events has seen little or no impact on being cancelled because the virus can't survive long outdoors. In relation to TT, I know there's a lot of concern from various people out there. Various people have contacted me about it. The public health advice at the moment is that would be an overreaction and there is no requirement to do so. But obviously we follow the situation very closely, and should that public health advice change, the Isle of Man government will act upon it, and that is the crucial thing. We are following the advice of the public health professionals who are basically the best placed people to offer advice.